And 2009 was a very important year for us, because that year, after we mastered after we mastered the trade, after we corrected some flaws in our company, we really exploded. We went from 7 locations to 15 locations. So 8 locations in 1 year. This was a big challenge. It was basically something that took a lot of sacrifice from our personal time and our family time. But at the same time, it was a time for perseverance. And that's, on slide 8 is the last thing, P, because you really got to be patient. And growing, you have to be very patient. And we usually have a funny lecture or a funny talk when we talk to new co-owners of our pharmacies. They open a new location and all of a sudden they want to be busy from the first day. So we always sit with them and we give them this pep talk, about relax, be patient. This is going to come. They're not going to flood your door just because you got a big sign on your door saying 50% off and $4 generics at Walmart. They're not going to do that. If you think you're going to, from the first day, you're going to just basically be so busy that you're not going to catch up, you're just hurting yourself. So usually this pep talk, we prepare it and we talk to them because we know that in 2-3 weeks they're going to be calling and saying, hey, it's slow. What do I do? I mean, there's no customers. I'm doing everything I could. I'm being nice to everybody. I'm offering this, I'm offering that. I'm smiling, I'm counseling, I'm da-da-da. We're like, well, that just doesn't do it. You got to be patient. And, luckily this pep talk has worked. We had not had anybody quit in the first 12 months. So, and again, this was a year of milestone because we did emerge from a small company to a mid-sized company. And we're proud to say we're probably the only mid-sized pharmacy operator in Michigan, besides the big chain, of course. And we're the only, alhamdulillah, we're the only mid-sized company of Arab descent where more than 120 employees work, more than 20 pharmacists practice every day, and sales exceeding $100 million. So alhamdulillah. This one I have to give credit to Mazen for this one. Because at that rate, when we're operating 16 locations, we kind of got bored, honestly. We just said, hey, we did this, what's next? And, leaders have to look into the industry and see what's in the industry for themselves. It's kind of maybe bad because, you did this, you did that, now what's next? Some people say, well, maybe just relax, spend some time, go to Yemen, husband, do something, But you know what? This was not in our blood. We said, Mazen said, because he came from a large company experience, there was a big buzz about the next generation of pharmacy. And I had my own run-ins with the next generation of pharmacy. And just to briefly summarize to you, retail pharmacy is your everyday use pharmacy. Every day the child gets sick, you need amoxicillin, you need motor for your mom. You walk in the pharmacy, you wait for the script, it gets ready, gets picked up. Next generation pharmacy has to do with caring for the chronically ill patients, those who have multiple and chronic conditions. And it takes a special type of pharmacy. And usually the pharmacy is closed door, meaning it comes by referral from physicians. Patients don't usually walk in a pharmacy. The patients are referred to the pharmacist or pharmacy by a physician or a healthcare provider. And usually the patients are chronically ill, so they really need a very talented pharmacist, and they really need lots of help in understanding the medication. So that field is called specialty pharmacy. And we can learn one more thing about leadership in this here, because this is where enthusiasm came in. Because here we are, we're making enough money, alhamdulillah, we're employing others, we're very happy with our operation, but we wanted to be enthusiastic about something new, something that others haven't done before, something that only larger companies have done. only companies that have sales of 500 million and above, companies where maybe 50 executives works and maybe 500 employees are employed. So we began exploring the biomed specialty business. And I know there's a pharma member here. This is top secret. Okay? we kind of joke about these things because we have a lot of secrets in the specialty business. But we share them, I would say, being aware of who are, about others who might try to do the same and fail. And not really, not for the fact that we're fearing of others competing with us. But again, we sat down and we began to look into the next generation pharmacy, and then in 2010 we came out with a new brand, and it's called Biomed Specialty Pharmacy, and alhamdulillah, so far that pharmacy or that type of division, or that division is picking up sales probably 4 or 5 times larger than a regular pharmacy. So I wanted to stop here because I wanted to give Mazen, my dear friend and partner, a chance to continue the presentation. But we hope to be here again. I want to take this minute to thank the AAYSP for putting this wonderful event together. I think it's a very good event to network with others from your descent, so you could see that others can do things. That if you network with the right people and you genuinely care for the success of others, you will benefit from knowing each other. There's no doubt. I have no doubt that Yemenis are as intelligent as any other human being on this planet. So, and we get this, we get this, not criticism, but this kind of question from other people very often, whether they're surprised that there are actually Yemenis that are leaders in their own field. And it makes me kind of upset, and it disappoints me that other Yemenis don't try to make others aware that they are as successful as anyone else, that they could do things as well as anyone else. So I wanted to end here, and I wanted to introduce Mazen Daisa. Again, he's my dear friend and my partner. And really, truly, I want to take this opportunity to thank him so much for bringing so many things from what he learned and share it with me genuinely, and kind of make our company a complete team.
Thank you. I do appreciate that. And my name is Mazen Daisa. One thing that Muhammad really taught me as a mentor, and as Muhammad said, we had a long history together since he was a pharmacist and I was actually a student. Provided me with a lot of recommendations, a lot of advice, and really a lot of insights on what needs to be done. I've always asked him, can you pay my tuition to pharmacy school? And he refused. I still don't know if he can pay my loans now, but it's been really a great learning experience. And with Farmore and with Biomed. And the reason why we kind of gave you a little bit of just introduction in regard to what happened in the company and how it evolved from one store to about 20 stores now, and we're venturing into different areas. It's just really to give you an idea about what's available for you out there. I mean, the opportunity is huge, the possibility is huge for almost every individual that is willing to take the effort, the commitment, and kind of going back to leadership, which really, the definition of leadership, it's really broad. And I'd like to actually just hear from some of you, how do you define leadership? Because during school, I've read books, I've seen PhDs, it's all about leadership and what it means. So, I'll open actually the floor just to kind of hear some definitions from your side. What would you consider leadership to be and a leader to be? Go ahead.
Someone that takes action.
Someone that takes
technically,
action.
they don't have to have a leader position. They could be like the secretary who's volunteering, but as long as they take action, I think they're a leader.
Someone that takes action, it doesn't matter if they're volunteering or they're actually for profit. Yeah, go ahead.
I think leadership is someone who can motivate and inspire and lead, not just command. Leadership is not about accomplishing tasks, but motivating people.
Leadership is about not accomplishing tasks, but actually leading and inspiring people. Thank you. truly great definitions of leadership. And it's we have a warning.
Leaders willing to follow.
Leaders are willing to follow. Right? Responsibility.
Take initiatives and also bring together like-minded.
Taking initiative and putting people together. Great, exactly. That's really, I mean, leadership is really a broad term. And one of the slides, that I found is actually something that a founder of Visa, which I'm sure many of you obviously use Visa or heard about Visa, D. Hawk, and he said, leadership is basically that if you list everything else, that was done to you and you were not happy about it, and don't do it ever, and then everything that you were happy about, and you were, and then you could spread it and do it to everybody else always, that's what leadership is. So it's really uncomplicated, in the fact that every one of you guys already a leader. I mean, the comments that I heard